I would love to introduce our next speaker, Dr. Bonni Goldstein. Today we're going to talk about the endocannabinoid system and autism. And for those that really might even not know what that word means, we're going to talk about that in a little bit, but really talking a lot about cannabis and how that's affecting our children. So thank you so much for being here, Dr. Bonni Goldstein. And do I call you Dr. Bonni or Dr. Goldstein? So I always call you Dr. Bonni, so I'm not sure what you go by.
Dr. Bonni's fine.
Dr. Bonni, okay, wonderful. Well, thanks for being here. I know you were with us last year, and I know that this is just a hot topic, and, it's definitely something we're seeing help so many of our kiddos out there. But before we dive in, for those people that are, new to this and maybe just, haven't really heard a lot about this, can we maybe give them a little bit of your background first, and how did you end up as the medical director overseeing clinics devoted to cannabis?
Well, I initially trained in pediatrics at Children's Hospital. I worked in emergency transport medicine, transporting sick children to various hospitals. And then I worked as a pediatric emergency medicine doctor for about 12 years. And after having a son and trying to be mom and doctor, I took a leave of absence, and during that time, I knew someone who was ill, and that friend had asked me about what I knew about medical cannabis. And, just like most doctors, I didn't know very much. But I started researching it, and I learned so much, and I was really amazed by the research and the scientific evidence. So I started working part-time in an office, and then I just haven't looked back. I've made it my full-time work, and I've now been doing it almost 9 years.
Wow. And, for so many of those listening out there, it seems as though when we hear the word cannabis, or, we hear CBD and things of that nature, some of us might get a little scared and, be really confused. I can promise you after this interview, you're going to have a whole new way of looking at it. I remember the first time I met you for my own son, Dr. Bonni, and I don't know if you remember or not, but I was so scared coming in going, I don't know what we're doing. I don't understand all of this. And you've just really guided us all along the way. And it's been, honestly, I would say the top 2 things that we've ever done for our son.
Well, that's great to hear. And really the way I look at it is that it just needs to be an option. It may or may not work, but since right now there aren't that many conventional medications that are really very helpful without toxic side effects, especially in children with developing brains, we need to have what you may call out-of-the-box options, and I definitely think that this is one of them. One of the things that a lot of people are afraid of is that cannabis could damage the brain or that it's dangerous. And one of the things that I have seen clearly over the last 9 years, taking care of thousands of patients, is that it's extremely safe. There's no guarantee that it's going to work for everyone, but so far I've yet to have anybody who's had any irreversible issues. Most patients, if it doesn't work out, they stop using it, and it's quite safe, and there's a return back to baseline if there were some side effects. But for most people, it either works or it doesn't work. There's really no harm.
And, for what medical, for those listening, what medical conditions do you treat in adults and children? Because I know it's a wide range out there.
Well, yes. And in adults, there's a huge number of symptoms and conditions that we treat, including chronic pain, anxiety, depression, other mood disorders, PTSD, sleep issues, autoimmune disease, multiple sclerosis, cancer, epilepsy, GI, gastrointestinal conditions. In children, it really is just a handful of conditions, including mostly children with intractable epilepsy and or autism. And then I do see a handful of kids with cancer and also maybe ADD, Tourette syndrome, these kinds of things. But in general, with children, it usually is, unfortunately, a last resort. And again, because it's so safe, it really doesn't have to be.
Now, there's been a lot of attention out there regarding medical cannabis. It feels like I don't watch the news that often, but every time I do, it feels as though somebody somewhere is talking about it. Can you explain the recent interest in cannabis as medicine?
Well, sure. So, we grew up knowing that people were using cannabis and it was considered illegal, and also because the federal government considers cannabis a Schedule 1 federally restricted drug. And so the Schedule 1 status means that it has no medicinal value, it's high abuse or addiction potential, and also lack of safety. And of course, this is not true about cannabis. However, the federal government has chosen not to reschedule cannabis into the other schedules that can be recommended to patients, prescribed to patients. And so there's the stigma that comes along with it. But what happened was in the late 80s and early 90s, there was research that showed exactly how the molecules in cannabis interact with the human brain and body. And this research resulted in the discovery of what is now called the endocannabinoid system. And the endocannabinoid system is a system that we all have. Our pets have it. Animals that have any animal with a vertebrate has it. This system, and the system is crucial because its role is to make sure that our cells are sending balanced messages to each other. So when your brain fires and sends a neurotransmitter from one cell to another cell, the endocannabinoid system acts as the regulator, as the balancer, as the feedback to make sure that those messages are being sent in a balanced way. And when we have illness or medical conditions, often there is an imbalance within this system. And we didn't even know about this. I didn't even learn about it in medical school. But there has now been study after study after study that shows that the endocannabinoid system is involved in just about every physiologic process in our brains and body, including our mood, our levels of pain, our motor coordination, our pleasure and reward, our immune system, our gastrointestinal system. And so these are all interconnected through the endocannabinoid system, and we no longer as physicians can continue to ignore the system. The problem for most physicians is that even if they identify this system as being the root of a medical condition or illness, unfortunately, the treatment is still considered a Schedule 1 drug. So there has been a huge amount of media attention because I really believe that now that the science is being sorted out, and we do know quite a bit, it would be nice to have more research, but we definitely know a lot about the endocannabinoid system. I think people are saying, let science lead the way. We know more now than back in the 70s when we put this drug into a Schedule 1 status. And, as of now, Kristen, we have 28 states that have some form of medical cannabis laws. And that's not because of coincidence. That is because the science behind understanding how the cannabis plant plays a role as medicine in the human body is understood at some level now, and we are seeing results in states that have medical cannabis laws like California, where we're seeing children with epilepsy doing well. We're seeing children with autism doing well. We're seeing a significant reduction in deaths due to opiate overdose. And so it's hard to fight these types of, or continue the fight of ignorance leading the way. The science has to lead the way.
Now, when we're talking about the cannabis plant, what makes it work as medicine?
Well, the plant itself contains hundreds of compounds, over 400 compounds, and there's a family of compounds in the plant called cannabinoids. The plant cannabinoids include a compound called THC, which many people have heard of. That is the compound responsible for the psychoactivity, what we call, quote, the high. But there are other well-known cannabinoids in the plant, such as CBD, and then THCA and CBDA and some other compounds. And what's interesting is THC is really the only psychoactive compound in the plant, and this poor plant's been vilified because of that one compound, but there's so many medicinal compounds in the plant. And when someone takes the plant, whether it be as an inhaled medicine or as a tincture or even cooked into an edible or even topically rubbed onto the skin, the compounds penetrate into the body and are able to target the endocannabinoid system to help that system maintain balance.
And so what exactly, when we're talking about, and I think I say it wrong all the time, but I'm doing my best. So for those listening, the endocannabinoid system,
you got it.
Did I say it right? Yay! Yeah. What exactly is that system? I have obviously some background with it with my son, but, I just know it's working for him. Luckily, he's a responder, but when it's talking about the cannabis, but I still don't always understand the ins and outs of the system.
Sure. Well, imagine a cell, like go back to high school biology, remember a circle, a cell, and on the cell wall sits a receptor. A receptor acts like a lock. So imagine a room with a door, and the door is like the receptor and it's locked. And so you have to have a key to be able to open the door to go into the room, into the cell, to send a message to someone inside that room. So what's happening is that receptor, like a lock, is sitting on the cell wall, and when a cannabinoid compound comes along and binds to that receptor, it basically sticks to it. What it basically is doing is allowing the message that the cell is sending from inside the cell to change. So for instance, there are receptors on the part of on the cells in the part of the brain that control anxiety, and those receptors are waiting for a signal to be able to change the message. So if the cell is sending a message of anxiety and it's, let's say, too much anxiety, what we need is something to come along and stick to the receptor and tell the cell, hey, turn down that message of anxiety. And so the cannabinoid compounds that come from the cannabis plant will bind to that receptor. Now, we don't have those receptors because of the plant. We actually make compounds that bind to those receptors. We make a key for that lock. But sometimes there is dysfunction or a deficiency of that key in the body. It's just like when someone who has type 1 diabetes doesn't make enough insulin. They have to take insulin from an outside source, so they give themselves a shot. If you had low thyroid, your doctor might give you thyroid pills to keep your thyroid in balance. Well, it's very similar. If you don't make your natural inner cannabis-like compounds, where are you going to get it from? Well, the cannabis plant provides these. And so some people say, well, why don't I make them? It could be genetic, something that's been programmed, or it could be something acquired somewhere along the way. I have patients that come in who've had a car accident. They've had a bad illness. Some women have an issue with childbirth, and for whatever reason, their endocannabinoid system stops making the key. They stop making their own inner cannabis. And then they find that, things are off. Their system is off. They now have medical conditions that are not going back into balance. And that by taking cannabis replacement, basically that's what it is. You're using the cannabis plant to put back those compounds into your body to then go back and maintain the balance of those cellular messages. That's why so many people find relief with receptors are, and as I've mentioned, immune system, the gut, the brain. There's so many different conditions that are in that group that it really is, a lot of people say, well, how can it treat nausea and vomiting and also treat epilepsy? Well, it's because of where the receptors are located.
Now, as you were speaking, a thought or a question came into my mind because I love the analogy you just gave about diabetes and, thyroid. Is there a way to test to see if you aren't making enough in your own system of the endocannabinoid?
That's a great question. So right now there is no test. And the reason is because when we make our own natural endocannabinoids, we make them on demand, meaning your body sees the imbalanced state and then produces them. And by the way, they're made from healthy fat, so it's important to eat healthy fat in your diet and to also give your children healthy fat. And if you, once you make them, they bind to the receptor, and then an enzyme comes along and breaks them down fairly quickly. So they've been described as short-lived molecules. So they're made on demand in response to a trigger, and then they're short-lived. So it's very difficult to go in and draw blood to look for these things. Now, academically, in certain studies, they have been able to check endocannabinoid levels. There have been studies where you can look at a tissue from the brain, but of course it's very invasive. Spinal tap or a lumbar puncture where you get spinal fluid out of the back, you can check for cannabinoid levels. But of course, these are not routine tests that you would do on someone. It's frustrating for me because I would love to be able to test people for endocannabinoid levels. However, right now, really my test is, does somebody respond? So if I give somebody compounds from the cannabis plant recommended in certain doses and they say, boy, I'm seeing a response, we know where these compounds work. So we know then that we're balancing that system. And so taking the medicine is almost like a test to see if there is an endocannabinoid deficiency.
Now, even as you say that, because obviously I have personal experience for my son, so questions come up, and it's great because it's different questions than last year, because last year I was still so new, with using it in a way. So you're talking about if they're a responder, but what happens if they start a strain and that strain of cannabis doesn't work? Because I know that's happened with my son, and then we went to another strain and that strain seemed to do better. So when you're working with a patient, do you maybe say, okay, it's going to be 2 to 3 strains we're going to try, because just because you don't see a response with this one doesn't mean you won't see a response with that one. Does that question make sense?
It does make sense, and I get asked that question all the time. And today I actually saw a girl in my office who has autism, and we are actually moving forward and trying other cannabinoids and other strains. And so it's a bit complex, but if you bear with me, I think you'll get it. So not only are there cannabinoids in the plant, but there's also terpenoids in the plant. Terpenoids is just a fancy term for essential oils. So all Mother Nature's plants make oils that are called terpenoids, and there have been over 200 terpenoids that have been described in nature and in the cannabis plant. And terpenoids are what gives the cannabis plant its distinct odor. But the terpenoids also have synergy with the cannabinoid compounds, but they also have their own medicinal properties. So, for instance, there is a terpenoid in certain cannabis strains called linalool. Linalool is also found cross-species in the lavender plant, and we know linalool in studies has properties, and we know lavender is anti-anxiety. So for many patients who are looking for calm, relaxing type response with cannabis, one might suggest a strain that contains linalool, and of course these can be tested for in the strains. There are hints. There are certain strain names, and in the cannabis world, the plants have different names. There's a strain called Granddaddy Purple, and there's a strain called Purple Princess. The purple kind of refers to that presence of linalool. Remember, lavender is purple, and so there can be some hints. Sometimes the strains have names that don't refer to that, but often the strain name can give a hint as to what's in it. But we're actually at a point where many growers and suppliers and manufacturers of the cannabis products are testing their strains to see what compounds what terpenoids are in them. And so this way, if something is working, one can see, this is the terpenoid profile that works for my child or for me. And if you try something that's not working, you can look at that profile and say, you know what, that might be missing something that might be beneficial. Another thing is that there's different cannabinoids. So we talk about THC as the main cannabinoid that's psychoactive, but there's another cannabinoid called cannabidiol, which is very much in the news, CBD. And CBD is not psychoactive. When it was initially discovered, it was thought to be inactive, and subsequently we found out that it's a very, very medicinal compound. pain relief. It's anticonvulsant, depressant. It's a potent anti-inflammatory. It provides neuroprotection. It can tell cancer cells not to spread. It's a really quite a amazing compound. But that doesn't mean it's always going to work in every person. Now, we also know that for the most part, what most people have used kind of over the history of people using cannabis is the heated up compounds from cannabis. When you think about when you very first heard about cannabis, someone smoking pot or something like that, we always heard about the heating up part, the smoking of it, or someone baked it in brownies. There was always the raw plant being heated up. And what we've learned in the past few years is that the raw compounds that are in the plant, which are denoted by an A at the end, so THCA or CBDA, the A standing for an acid form, that these compounds are also quite medicinal and, again, not psychoactive. But what I'm seeing over the past year or so is that patients are now able to obtain oils or juice made from the raw plant. And basically what you're taking is the raw cannabinoids, which also have medicinal value, anti-inflammatory, anti-nausea, anti-tumor. And so they have not been studied in depth. We have some idea of what they can do, but I've actually started to see that THCA, which again is the raw form, it comes in a bottle as an oil, and it just hasn't been heated up in the process. And I'm seeing a lot of patients responding to that with calm, with focus, with better attention. And again, I don't have a lot of studies to back me up on this, but at the same time, we know that it's basically raw plant that's quite safe, and it is quite medicinal for many people. So we're starting to see, and also I should say it's an anticonvulsant. I have some patients that are not responding to CBD oil for epilepsy, and we switch over to THCA, and we start to see the anticonvulsant effects. Going back to your question about would I try different strains and different cannabinoids, absolutely. I have one family who tried about 7 or 8 different things and finally landed on a strain that is helping their daughter tremendously. And what's interesting is that she has a brother who's on a different regimen, which is helping him. And so even genetically related children are responding to different strains and different terpenoid profiles. So it is important that sometimes it's not it's not the first medicine that you try that determines whether or not you're going to respond. I work with families and say, if we're really not seeing anything, we may want to sit down and reassess. But it does appear that one can try somewhere between 3 and 5 or 3 and 7 different strains to really see if there is something in there that might work specifically for that person.
As you're saying that, because, we've tried a couple with our son, but I'm thinking, too bad there wasn't like when you go to a restaurant and you order a flight and it could be different wines, too bad there wasn't like a little flight kit they could give you that had, 3 to 5 different strains. And
sure.
You
hey,
could
maybe
go home
somebody will do that. Yeah.
I think that would be so fantastic because, typically what I come across is that when somebody makes a strain and they're the producer of that strain, to them that's the best and the end all for everybody, for them at least, which sometimes it is and sometimes it isn't. But it'd be so great if somebody could say, okay, let's put 3 to 5 of these together, and that way the parent doesn't have to invest so much, and then they have the next one ready to go. And because often if you're going down this path, there's definitely a reason, for it, whether it be seizures, whether it be aggression, whether it be, different symptoms. And so it's sometimes often hard to wait, as a parent. At least I'm learning a lot of patience. I'm sure those listening who have children are learning that too,
And it also is not, for very few number of patients, there is an immediate effect. But remember, too, if the brain has been out of balance and the endocannabinoid system is not functioning well, it can take time for that balance to come back. I have a young man I'm taking care of who was born with a congenital brain malformation. And this boy did not walk when he first came to see me, and he started walking about 18 months after starting cannabis oil, and he really came because they were looking for help with seizures but also with self-injurious behavior. And he had other things going on that the parents didn't even focus on in terms of treatment, but he had vomiting. After 10 months on the oil, he no longer vomits at all, and this is a boy who would vomit all day long. They walked around with cups and change of clothes and bibs and all kinds of things. He no longer vomits, but it took 10 months of kind of finding the right dose and also letting that brain get back into balance. The walking, I mean, this is a boy that they were told he would never walk, and he's been now walking for quite some time, but it took about 18 months. And so I always tell people that once you get started, we may see some improvement, but if you give it time, let that system get back into balance. It doesn't happen overnight. Over time, I think a lot of parents who see success with cannabis, what they see is that it just gets a little bit better and a little bit better and a little bit better as their child becomes, their brain gets more into balance.
And one thing, to mention as well is that you might have the right strain, you just don't have the right dose. I know you said it briefly before, and so sometimes it takes a while to figure out what that dose is, and then you have to kind of step back and go, okay, is this the dose? Is this not the dose?
And you have to give it time. You have to observe. If it was as easy as I could eyeball somebody and say, oh, this strain's going to work at this dose, boy, I'd do that right away. But that's just, unfortunately, it's such a complex system in the brain, and then the plant itself is so very complex that taking this complex plant and giving it to a complex brain, it's just not as simple as, like penicillin to kill strep throat. That's a straight line. But this, unfortunately, is a little more sophisticated than that.
Now, you brought up THC and THCA and CBD. I know obviously the answer to this, but those listening, and I remember not knowing the answer to this before, can you take CBD and THC? Can you take CBD, THC, THCA? Can you combine this, or do you have to kind of pick one or the other?
So when I treat patients, and I think a lot of doctors do this, we usually start with one compound so that we know exactly what that compound does. So with children with epilepsy, we usually start with CBD, but sometimes we'll start with THCA. Same thing with children with autism, and it really does. You have to kind of look at the whole picture, and I treat patients case by case as unique individuals. However, many of my patients are on one compound, many are on two compounds, many are on three compounds, and sometimes it's the target is that we are looking for different things. So, for instance, I have a young lady who I take care of who came to me with very severe seizure disorder and some behavioral issues. And when we started her on CBD, really what happened was impressive cognitive improvement, but the seizures didn't change. When we added THCA in, that's when the seizures went down. It was having some behavioral issues, and I think part of that is because we were starting to see who she is, and she had some behavioral difficulty, and so we started adding in very, very low doses of THC just for calming, and it did help her focus. It also helped her sleep at night, and so now she's on all three. The target of each medicine is kind of a little bit different, but at the same time they all are working together to really give her a well-rounded a response. And one of the best things about, taking care of patients who have these kinds of issues, she really wasn't able to do anything when I first met her, and now she's using an iPad to communicate. She started crawling, she started standing, and she's been able to take a few steps, and it's been huge for her family. And in fact, she even said, Mama, for the first time, which was, brought tears to my eyes when they sent me that video. And so in using combination for her, it has worked out very well. Not everybody responds that way, but certainly having access to all the compounds in cannabis allows someone to really figure out what's going to work for their child or for themselves.
And you talked a little bit about this, but do you want to elaborate a little bit more, for those out there, why does cannabis work for some people and not? I mean, is it the matter of just trying to find the right strain, or is it the matter of, maybe it's not the endocannabinoid system that's the problem?
Right. Well, and we know that when we're using cannabis, we're targeting the endocannabinoid system. So one of the big issues with cannabis, it's very hard, believe it or not, to get the body to absorb cannabis medicine. It doesn't seem like it should be that hard, but it is. So we know that when somebody inhales cannabis, you're really only getting about 30% of what you inhale actually into your system. If you take it under the tongue or you eat it, you're really only getting something like 4% or maybe up to 25% absorption. So it's not the easiest thing to absorb into the body. So that may be an issue. And remember, we all absorb, metabolize, and excrete. We're all human, but we all do those things differently. There are people that are quick metabolizers. There are people that are slow metabolizers. There are people that are good absorbers. There are people that are bad absorbers. And so depending on where you are, and now, there is some new genetic testing, so you can kind of see how you metabolize medication. It may not be indicated for everybody, but even today in my office, I had somebody that came in who's really struggling and has not done well with any conventional medicine. And it turns out when they tested her, she has basically a genetic difficulty with metabolizing medications. And this is why they just don't work. She just can't seem to get them into her system. And she has a difficulty with them. So with cannabis, that's one of the issues. One of the other issues is that with every medicine, we may have people genetically who are responders and who are non-responders. So there's certainly a chance that somebody has an endocannabinoid deficiency or dysfunction, and for whatever reason, cannabis is just not working for them. They're just not able to make that connection. Maybe there's a defect in the receptor. Maybe there's a defect within the system somewhere in the circuitry. So it's really hard to know. I will tell you that in my practice, probably somewhere between 70 to 80% of patients who try do get some benefits. They're in that group. There are people who get excellent results, and then within that group, there's people who would answer the question, "How are you responding to this?" And they would say somewhat effective, and then somewhere between probably 10 to 30%, kind of depending on the condition, are people who just don't find it to be helpful. And so it's still a pretty good number for people who do find it helpful. And again, until you try, you're not really going to know. For many patients, they've tried other medications, and that's what leads them to try cannabis. For other people, they read the side effects, or they see maybe they're told, "Hey, we don't even have anything for your type of condition." And then cannabis is the only thing that they can try. Again, I just feel like for patients who are ill, who have a possible problem within their endocannabinoid system, that this obviously should be an option.
Well, I know, for my son, he's obviously a responder, thank goodness, because it hasn't always been that way with the many, many, many therapies, and it's at the point now where we will not go anywhere without it, kind of thing. That's how much it's changed our lives. Now, is he recovered and all that? No, but is from where we started with to where we are today, because we walked into your office with a totally different child, to where we are today with some of his behaviors. And, we're seeing him improve in other aspects. Clearly, we're doing other things, but, to add to that. But I tried CBD oil, just the CBD oil I have IBS, and I wasn't a responder, and I tried for nearly a year. I wasn't 100% perfect, always remembering to take it, but I did take it more than I took anything else. And I didn't really see any good or bad, effects. And, him and I are clearly related. And yet, so his system clearly is different than my system, and I had really had high hopes that it would, be something that would work for me. And again, it could be that I didn't try another strain, and I'm not that patient with my own self as I am with my own son. But I find it interesting, when I talk to people, and they get so kind of like thrown back a little bit. Not as much as it was a couple years ago, but it seems like there's still this stigma around it. And I always remind them I'm like a very conservative person, and this was something for us that I don't want to say it was like last resort, but it definitely was on the bottom of the list of like, do we really want to go there? And once we learned about it, and we learned that it's something used for medical conditions, and again, I love your analogy if, my child had diabetes or if we had a thyroid issue, when we were able to look at it in those terms, I kind of threw away the kind of thought I had of, I'll age myself here, but from watching like Dazed and Confused and, watching movies like that, or, growing up and, some of the kids, smoking pot and getting high, as cool as I thought they were and nice people, because, there was nothing wrong, I never did that. And I had this I had that stigma in my head of like, I don't want to give that to my son. That's
Sure.
not, who we are. And when you start to learn that this is really a medicine used to heal our children and so many of all ages and so many people for so many conditions. It's not just for the terminally ill cancer, patients. That's the one thing I had heard about, the use. It's really used for our kids that are, they have so much inflammation. They have so many things going on. And so I really want the people that are listening that are ultra conservative, as I was, to really kind of be open-minded about it, because, I really think that the world, especially the United States, I should say, is becoming more open-minded. Would you agree to that?
I do agree to that, and with that, and what's interesting is that, we have to remember that a child who is ill, if my elderly parent was ill, this is not abuse of some substance. This is true medical use. I am the mom of a teenage boy. My son is well. My son should not use cannabis. He's well. He shouldn't be taking any medicine. So we have to remember that we can't compare a child who may have an endocannabinoid dysfunction or deficiency with a child who doesn't. I would not recommend giving insulin to someone who did not have diabetes. I would not prescribe thyroid hormone to someone who I did not think and did not have proof of a thyroid problem. So we have to remember that this is not a cavalier use of cannabis. It's just another tool in the toolbox that we can use to help people who are struggling or suffering from medical conditions. So to compare your son with some teenager who's skipping out on school and smoking pot behind the bleachers is, to me, a ridiculous comparison. Now, that comes, though, from kind of the stigma and the propaganda that's been politicized, and it's been in our environment growing up. Don't do drugs and say no to drugs and all of that. Well, in general, of course, we don't want our kids to be using things, but the same time, that doesn't mean that we should deny medicine to sick people. And so if we can recognize the science, the same way we recognize the science of antibiotics, we recognize the science of diabetes. We recognize the science of, if your appendix bursts, you probably should go have surgery and get your appendix taken out. This is the same concept. This is well-known science. This is not, voodoo. There is study after study after study, so many of them that it's hard to keep up these days because it really is a hot topic in the science world as well. All of these studies are looking at the endocannabinoid system and the role that it plays in illness. And so, if listeners want to go to something as simple as go to the website called Google Scholar and just put in the words endocannabinoid system, you will have reading for the next 6 months. You probably can't keep up with it. But you'll see things if you wrote in endocannabinoid system in cancer, endocannabinoid system Parkinson's disease, endocannabinoid system autism, you would see the articles that are coming out in the scientific literature that is documenting the science behind this. So, it's interesting. I had a conversation with a new parent a few weeks ago who said, I thought this whole endocannabinoid thing was some hippy dippy thing. She goes, but it's real. I looked it up. And I just thought, but the reality is if you don't live in the science world and it's not your focus, how would you know about it?
Yeah, that's
right?
true.
It's the same thing. Now, we grew up with our doctor saying, oh, you have strep throat or you have an ear infection. Here's an antibiotic. So, we know about that as we get older. And when we become parents and we're taking care of our children, our child has an ear infection. Oh, the doctor wants to prescribe something. We don't question it. We don't ask them, hey, how does that work in his body? What is that going to do to him? Right? We just kind of have an understanding because it's been something that's been in our vernacular. But at the same time, this whole cannabis thing has always been in the negative. And now not only do we have to move it out of the negative into the neutral, but then we're trying to say, hey, no, it's a positive thing to have if you have an endocannabinoid imbalance. If this is your medicine, you should have a right to have this. It should not be politicized. And so I really do think we're moving forward. As of right now, Kristen, we have 28 states, as I mentioned, that have medical cannabis laws. There are 8 states that have legalized it for recreational. And what we're going to see is slowly but surely more and more states, because there is pressure mostly from parents of sick children who say, I have to have access to this.
Well, and I think it's one of the few things out there, because I can't even think of a comparison of where it's medicine, right? Some people do use it for recreational. It's not the same thing as like drinking a glass of wine and then using wine for medicine, right? Although I wish they did have wine for medicine. That would be great. But it's not the same thing. And I think that people, I think they can't draw a line in the middle and say, okay, yes, it can be used for this, but we actually found out how wonderful and how lucky are we that we found this out. I mean, I feel so fortunate that we were able to find something honestly so simple, and it really is so simple. It's a plant, that can help our children in a way that we didn't know about. And, the one question that I get a lot is, for your son, aren't you worried that he's going to get high? Like, I get that question probably more times than I can count, and then they tell me he's going to get addicted. He's going to get addicted. He's going to get high. The only reason he's happy is because he's probably walking around high. That's usually what I get. How do we respond to that?
Well, and that's a great question. So remember that if you have you don't have enough, let's say you don't have enough insulin, right? When I give somebody who doesn't have enough insulin, when I give them insulin, I'm taking them from a low level or a no level up to a balanced level to create a balance within their sugar metabolism, right? So they're going from a low-level state up into a balanced state. Now, if I took somebody who has normal insulin levels in their body and gave them a shot of insulin, they would go overboard. It would go up into the over state. From the person who doesn't have any insulin is under what we call hypo to a person who's hyper. So when we're treating people who have endocannabinoid imbalance or deficiency, those people are in what we call a hypo state. It's like having low thyroid. It's low. So when I give a patient who has very low levels of their natural cannabis-like compound called their endocannabinoid, what we're doing is just trying to get them up into a balanced state. I'm not trying to overshoot it and get them to be high. And so all children have some ceiling dose of THC, if you were to use THC, that would push them into what you might call high or stoned. But it's very simple for parents to see that. And so if you, let's say, were to give somebody 1 ml of a THC concentration, let's say you gave them 10 milligrams, and they get into a state of where it's too much, okay, 10 milligrams is our ceiling. Let's back down from there. And that's okay. There's nothing bad is going to happen to your child. And so for many patients, though, we don't ever find that. We start low and we tiptoe up. And what parents report is, I'm giving my child just 8 drops of THC oil, and they're doing great. I'm seeing focus and calm, and it even stops some of the seizures. But, it's funny, my child's not high. Parents can tell when their child is doing well and when their child's not doing well. We have to give parents credit for knowing their children. And most parents who have crossed the line have told me, oh, you know what, we gave too much. And I say, back down. It's very simple. You don't go too much too many times. Usually it's once or twice and you don't do it again. So that's one thing. the part about the addiction is really interesting. So, as that whole idea of cannabis is a drug of abuse and you can get addicted to it and so on, the studies clearly show, and these are government studies, that about 8 to 9% of what we call recreational users of cannabis become dependent on THC regular basis, and usually they're overdoing it, but again, that's recreational use sometimes. They're overdoing it, and what happens is that the receptors kind of get so used to it that they create a tolerance to it, which means that they have to actually take more in order to get the same effect. And part of that is the self-preservation mechanism that we all have. Our receptors, if they're being inundated with THC, the receptors will actually hide. They'll kind of go from the cell wall, like on the lining of the cell, and they'll move into the cell and they'll hide. And so THC can't bind to them anymore. And so what overall happens is that you have to take more and more THC in order to actually feel the effect, because you have to hit the few receptors that are left. This is not an irreversible state. So what ends up happening is that if you abstain from THC, what happens is those receptors, they kind of get the all clear and they will pop back out. And so you can have this dynamic state where you can have low receptors, you can have high receptors. But again, you have to remember, too, that in certain states, and they've shown this with children with autism, they've shown on white blood cells of children with autism, white blood cells, receptors on their cell wall, that children with autism actually have extra receptors. It's as if their body is basically saying, we need more cannabinoid. We're going to make extra receptors so that we can try to find every cannabinoid molecule. And so it's very interesting, because the only time we actually see low receptors is really when somebody's overdoing it. And again, it's very easy to fix that by just lowering the dose or abstaining or changing the strain. What can happen in terms of when we talk about addiction is that very few people actually cannot, or very few people have a true withdrawal syndrome. Somebody who's a chronic heavy user, usually a recreational user, chronic heavy use of THC will lead, if you abstain, to some withdrawal. And the withdrawal is no worse than a withdrawal from caffeine. Usually for most people it's a little irritability, a headache, maybe between 5 days and 2 weeks, and then pretty much disappears. I don't know about you. I've tried to quit my caffeine, and it was miserable. And so most of the patients who tell me, oh, you know what, I ended up using too much, I wasn't feeling well, or even patients who were recreational users who now want to use it as a medicine, who ask this question, I always say, just be careful with your use. Try to take a day off here and there, or try to back down and substitute with THCA or CBDA or a little more CBD. Let the other cannabinoids do some of the heavy lifting. There's no reason for a medical patient to worry about addiction or dependence or tolerance, really. It's usually a non-issue, and if it becomes an issue, it's easy to fix.
And the THCA is still kind of a little bit new. I know you'd already talked about it. It's the acid form, from what the A means, from what I remember, and that means it can't. It doesn't have like a tolerance level, meaning that you don't build up a tolerance to it. Correct?
Right. It appears that the other compounds, so CBD, THCA, and CBDA, do not appear to create tolerance. In fact, what I'm finding with a lot of my patients who have epilepsy who are using CBD, at some point they get into such good balance, if they're a good responder, that we're actually able to back down on some of the CBD medicine for them, so that they don't really have to take so much. That's not every patient, but many patients, once they find their dose, that's where they're able to stay, and sometimes we're even able to lower it, or lower the, if we're taking it 3 times a day, they're able to go to twice a day. So we just don't seem to find tolerance with these other compounds.
Oh, okay. So basically new. So it's how long has that been on the market?
Well, so a few years ago, there was a doctor in Northern California that was recommending patients to juice the plant. But there was a logistical problem with that, and the logistical problem is that you have to have lots and lots of plants to be able to pluck off fresh leaves and to juice it. And so for most people, having a whole bunch of cannabis plants is not really an option. You may not have property for it. You're worried about the legality of having all these plants on your property, with law enforcement, even though as a medical patient you can have them. But at the same time, you can put yourself at risk. And so not having the, access to that, a lot of patients said, well, this doctor has a great idea about juicing it, but really that's not going to work for me. And I don't know anybody who grows it, or I don't want to juice something that may not be organic. If somebody even maybe says, oh, here's some leaves, you don't know that they're organic. So what's happened is a lot of cannabis growers and suppliers are now making basically raw cannabis oil. So they take the plant material and without heating it up, convert it and extract it and turn it into an oil. And it can be taken under the tongue or swallowed if someone's not able to take it under their tongue. But remember, you can't apply heat to it. So you can't put it in a vaporizer or put it in a joint or bake it in brownies, because once you heat it, you're converting it.
Gotcha. And now let's talk a little bit about the quality of cannabis, because especially, obviously I'm in Southern California as well. It seems like there's a lot of places now that are just popping up and, with cannabis, and it's really hard to tell, what's good, what's not. I actually know people that say, well, I grow it myself, and, and to me, that's the business I don't want to be in, because I could barely make regular chocolate chip cookies, right?
Okay.
I can't even imagine trying to make,
Sure.
cookies with cannabis in it. I don't think I do very well with that. So, as a parent, I want to know that where I'm going, I'm getting it from the purest and highest quality out there, kind of when I think of almost a compound pharmacy, right? I want to be able to find places that are similar to having products of a high quality. How do I find that?
Well, so this is the thing. So in California, we have not had a regulatory system, but we are going to that. So by January 2018, all products on the medical cannabis market will have to be tested and pass a basic standard, including potency of how much THC, CBD, or whatever other compound in it, the pesticide testing, bacteria, mold testing, what we call residual solvents. So if somebody's using a solvent to make the compound, at the end result does not continue to have solvent in it that's supposed to be purged out of it. And all of these things are going to be required. Unfortunately, we haven't had that, but at least we're headed in that direction. Most other medical cannabis states, they put that into their law. They kind of learned that what not to do the way California did it without that regulation. Most other states have a basic regulation of the products that have to meet a certain standard, and they have to be labeled properly. They have to be batched so that it can be traced back if you get something that's questionable. And so this is a good thing. I always tell patients, do not buy something that's not tested. I just had a cancer patient in my office the other day, and she's been buying oil because she found someone that was willing to help her. And I said, what are you taking? I don't know. Is it tested? I don't know. How many milligrams? I don't know. This is unacceptable to me as a physician. Because one, if it's not working, we at least want to know if we're going to switch, that we're switching to something else, something different. And how would I know if it's different if I don't know what it is? But if it is working, what's working for that patient, so that we can have repeat and be able to continue and have consistency in treatment. So it's very important. Now, how do you find that? You, unfortunately, in this particular kind of industry, you have to educate yourself. You have to seek out somebody who's knowledgeable and take the time to possibly, if you're going to get a product, take it to a third-party, independent cannabis testing lab and pay to have it tested so that you can see exactly what's in it. Now, in the past 5 years that I've been taking care of pediatric patients, I will tell you that in the beginning, many of the parents were getting the oils tested over and over again to make sure that they were not giving their child something contaminated. And because I'm the doctor for many of these patients, parents were sending me the test results, and so a lot of test results were coming across my desk, and it clearly stood out which suppliers were good suppliers and which suppliers were not good suppliers. Luckily, we have Facebook, and we have parents sharing information online, And a lot of parents would come to me and say, oh, I already know which oils I'm going to try. Well, how do you know that? Well, I was on a pediatric epilepsy Facebook page or a pediatric autism Facebook page, or I talked to a mom who's online and shares information, and she showed me the test results of this oil or that oil. So a lot of people do have an idea of what oil is safe for children, is safe for really any patient. We certainly don't want people to be using things that potentially are contaminated or potentially could be dangerous with solvents.
And what do we say to the moms that are out there that are saying, so and so down the street is making it, or they want me to buy it from them, and what do I do? What's your? Because I've actually been approached countless times, and I always just say my doctor has recommended a couple of different places, and this seems to be working for my son. And we actually did do that. We sent it out, even the one that was working, to a lab. We've only done it once, just to kind of get an idea if there was really that much potency in it. We were curious, and there was, and so we could look at our son and tell that it's working, but we were just curious because we had never done it. And so we had a friend that had a third-party lab connection, and very, very reputable. And so we said, well, you know what, let's go ahead, and it's not going to hurt to to send it over just to get an idea. And it just kind of put us at peace of mind, knowing what it was. The other thing is that the place that we go to, anytime I've ever asked, can I please have a, the labs, from this product that was ran, they always send it to us. That also, but I mean, the fact that we did it third party too, and we were able to match it, and it was basically apple for apple, at that point,
right. Mm-hmm.
To me, as a parent, we did our due diligence,
Right.
And so, but what do we say for down the street when, Mary's selling it or whatever? Right. What do we do?
Well, again, if somebody approaches a family, and I've had this, and I even wrote about it in my book, I had a family that came to me with a syringe full of oil, and the mom said, I don't know what it is. And I said, well, have you given it to your son? No. I said, well, someone gave it to you, you didn't pay for it, just, spend the money and just get it tested. And it turned out that it was chock full of rubbing alcohol. Now, not everybody is a chemist, so somebody may have started thinking, oh, I know how to do this, and the alcohol is going to cook off, but they obviously didn't know. And apparently if you were to use rubbing alcohol, which I would not advise, is that you're supposed to purge it at the end. There's another chemical process to purge it out. But they did not do that. And so we do have to be careful with people who watch a YouTube video and decide that they're able to make medicine for somebody who's ill. This is, to me, unacceptable. And there are now enough established companies with websites that put their test results on their website. You can even call the lab and say, hey, I saw such and such company is posting from you guys. What is your standard? How many do you test? I mean, now we have like a paper trail of companies that they want to show you we are doing it right. We want to be your cannabis provider. We're going to jump through every hoop that's required now by the government in order to have clean medicine that's safe and tested and consistent. And then there's going to be the people who just kind of cook it up in their house. If you ask me, I'm going to tell people you go with the tested, known entity rather than go with the guy down the street. And, the guy down the street may be very altruistic, and he really does want to help. But when you're talking about your child, or you're talking about your loved one, or even for yourself, why would you put something in your body if you don't know what it is?
And that's a great point. The last thing I want to say about this is that if they don't ask you for your medical license, meaning that at least in California, I don't know how all the states work, but I know in California, obviously we go to you, we have to see you, we get a license once a year for our son. If we have questions throughout the year, we contact you. And, we use you as our doctor because you are a specialist in this. What I get worried about is those out there that says, oh, don't worry about it, we don't need a license, and they kind of like wink at you, I think that's what's going to hurt the cannabis, the medical use of it more than anything, because it kind of takes away from the validity, making it valid. If I went to a pharmacist and I said, hey, wink, wink, I need some, for lack of a better, analogy, penicillin, right? They're not going to go, oh, sure, here you go, here, just give me $5. They're going to say, I need a doctor's script for that, and I think we need to think of it in those same terms.
I agree, and also this is why I believe in, I jokingly call it the separation of church and state, the difference between medical and recreational. There are always going to be people who want to use cannabis recreationally. It's been like that for thousands of years. That is not going to change. We are not going to win a war on drugs when people want to use something. Okay, we have to talk. To me, education is the key. And we have to educate our youth to understand they have a system in their brain. They can mess it up if they're well, but if they're sick, that maybe this is the medicine for them, and so on. But at the same time, what we have to remember is that medicine should be medicine, and then those people who want to use it recreationally have a different issue. What I want is for patients to be able to walk in to a collective or dispensary, a cannabis pharmacy, and to have somebody behind the counter who's knowledgeable, to have the confidence that the products are safe and tested, everything in there, not just some of it, but also that there's accountability, so that if you were to get something that was contaminated or something that was, just like in any pharmacy, you'd be able to go back and say, hey, there's something wrong with this medicine. There has to be that responsibility and that accountability. And I think that we are getting towards that. Once we have the separation between recreational and medical, the medical side will be medical. Right now, the waters are all muddy because there's been this kind of abuse of the system by people who want to access, but also by doctors who are giving letters out to whomever, right? Oh, it's so, there's a joke, it's easy in California, you just, call a doctor and say you have glaucoma and you can get a letter for medical cannabis. Well, once we make it recreational, we don't need to have that anymore. That bogus part of it is going to go away. People who want to, just the same way you can go buy a 6-pack of beer or a bottle of vodka. Once you're over 21, if you want to access cannabis, you can use it for your own personal recreational use and do that. But you see, I'm on the medical side, and what I want is I just want to have that medical side be regulated so that a patient can have confidence in their medicine and accountability in their medicine and know that it's tested. And the worst thing to me is to have somebody who finds something that works and then they can't find it again. And so that's why companies who are doing it right are the companies that people should be using. And so everybody needs to kind of contribute to that. Right? So if you go into a dispensary and you see medication that is not tested, don't get that. Why would you get something that's not labeled properly?
Absolutely. 2 last questions. I can't believe our time is up. I always learn so much from you, and I'm so grateful for all you do for not just the autism community, but just the community in general when it comes to health and wellness. What resources are there for parents who are looking for information about cannabis? And following that question, what happens if they don't live in a state right now that maybe they can't get this? What resources do they have, if any?
Right. So for people who don't live in a state that has a medical cannabis approval, what I tell people is get involved and try to talk to your state legislators, write a letter to your governor, explain the situation that your family is in, get other people involved as well somewhere. So all of these 28 states that we now have medical cannabis laws are, not every state has access to medicine, but they're not going to put parents in prison for giving their child medicine if you can get a hold of some medicine. So that's number one. You can change the laws. Don't give up, because it's being done all over the place. There are some products, and I cannot endorse any specific products, but there are some products that have kind of come to the forefront that are out there that have CBD in them, and they have very, very low levels of THC, so they are considered hemp products. There are a handful that are good, and there's a lot that are bad, but there are some families and states that do not have medical cannabis laws that are able to buy hemp from other states. But be very careful, do your research. Talk to other parents. Don't just talk to the people who sell it. Talk to other parents and spend a little time. Don't just jump the gun and buy it, because there is a lot of stuff out there that's bogus and that's probably not safe. And then in wherever you live, whatever state you're in, if you need information, there are a handful of nonprofit patient based or patient-centered organizations. And so I am on the advisory board of a group called United Patients Group. It's a lovely group that if you call as a patient, they will help you understand the laws in your state. They will help you to understand, and they have a ton of information on their website, which is unitedpatientsgroup.com. There's also a wonderful nonprofit called Project CBD. Project CBD also has a ton of information for people. It provides a lot of scientific information, and they also know a lot about the laws in certain states and what's allowed and what's not allowed, and can also point people in the direction of what medicines that might be helpful. And then, there are a handful of other nonprofits that are out there that if you go online and just Google, medical cannabis or CBD and nonprofit and so on, you will come across. And I do encourage people to use Facebook and social media just to connect with other parents who are finding success. Remember that even though your child may have the same diagnosis as another child, or as an adult, like, IBS, and somebody else has IBS, we're all unique individuals, and we're going to respond. So you can't take, this parent had this great result, so that's going to be for my child. But it at least is a place to start and to have some support from somebody who has been there and done that. That is a good place to start. But at the same time, and it's a bit unfortunate, there's not that many doctors that are comfortable with medical cannabis. But the good news is that I go to conferences all around the country every year, and I'm meeting more and more doctors that are getting interested in this, that are starting to be able to really help patients. So if you just do your research online and you call some of these nonprofits, they're often able to point you in the direction of getting some help.
That's wonderful advice. And where can people learn more about you specifically?
So I have a website. So my website for my office is cannacenters.com. And then I have my other website, which just has some patient information, BonniGoldsteinMD.com. Probably those are the best two. And then I did just recently put out a book that kind of goes over the endocannabinoid system and 28 different ailments that cannabis can help. And also a chapter, it doesn't have specific dosing because that would be irresponsible, but the chapter is called How to Use Cannabis as Medicine, and it talks about how you might read a label on a cannabis product. It talks about what a ratio is, how much CBD to THC, and so on. And the book is called Cannabis Revealed, and it is available on Amazon. And
when did that come out? I didn't even know about that.
Oh, I'm so sorry about that. I didn't tell you. It came out at the end of December.
Okay.
And it's available, and it's like a reference book. And so when you have a question, you can go to it. I have a fair amount of patient stories in there that I'm so happy to share, and that my patients were so happy to share with potential patients to understand how cannabis has changed their lives. And really, it's a reference book for people to be able to say, okay, what's the real deal on this? Because unfortunately, there is a lot of misinformation on the internet, and we all know that. But at the same time, I can't dose people through a book. Again, that would be irresponsible, but it is a place to start so that one can understand what the endocannabinoid system is. And I've had patients in the past say to me, doctor, you just spent an hour explaining everything, and I'm only going to remember a little bit. So where am I going to find this information that you gave me? And I realized there really wasn't my perspective out there, that information and what I've learned over the years. So I decided to write it up and put it in a book, and now it's available to people.
Oh, I would have loved that when we first started. I'm going to get it now. And it's called Cannabis Revealed, you said, and that's on Amazon?
On Amazon, that's right.
Oh, I think that's awesome. Gosh, I always feel that, the journey that we've had with my son, I feel like each year that people are maybe getting newly diagnosed or, maybe they've been on the journey for a little bit, have it so much easier than some of us that had started longer ago, because I feel like more and more information's out. I'm sure people years before us, they feel the same way when we came along, right?
Absolutely. and remember too, when you very first came along, THCA wasn't really out there, and now it is. And so what I tell people is that this is a dynamic industry. Things are changing so fast, and it's almost very difficult to keep up with. But at the same time, if you stay current and stay with the trends and connect with groups like United Patient Group or Project CBD, you'll be able to stay on top of kind of what's new in this industry.
Well, I can't thank you enough. I feel like every time I talk to you, I feel full of hope. And I know those listening, I'm sure, feel just so hopeful, that fact that science is catching up and they're never giving up. I always think of science as not catching up, catching up, but also not giving up, because, there's always something to learn, and we always want to go one step further. And, I feel like anytime there's an option or a menu that you can, look at for your child, and there's more than 2 things to choose from, I feel like we're doing much, much better than what we used to be. And so for those listening, definitely check out the websites. We'll make sure to put those in the transcripts and also in the Hope Workbook. And please check out her book. I'm really excited about that. I'm new hearing about it just like you guys are, so I think that what a great tool for us to have. So thank you so much, Bonni, for everything you're doing for our kids and honestly just for everyone's health.
For the chance to share information with everybody.
And thank you all for listening.